Please subscribe our channel. Press bell icon to get continuous updates. Thank you. Most common hallucination in schizophrenia. Option A, auditory hallucination. Option B, visual hallucination. Option C, olfactory hallucination. Option D, tactile hallucination. Answer, option A, auditory hallucination. Schizophrenia, the term given by Eugen Bleuler. Most common type, paranoid. Best prognosis, catatonic schizophrenia. Fundamental symptoms, foray of Bleuler. Ambivalence, autism, affect disturbances, association disturbances. Gastric lavage is contraindicated in poisoning with option A, sulphuric acid, option B, organo-phosphorous compound, option C, arsenic, option D, datura poisoning. Answer, option A, sulphuric acid. Gastric lavage is contraindicated in corrosive poisoning except carbolic acid. In convulsant poisons, comatose patients, upper alimentary diseases in like esophageal varices, then patients with marked hypothermia and hemorrhagic diathesis. Introduction to Organon of Medicine was first introduced in option A, first edition, option B, sixth edition, option C, fourth edition, option D, second edition. Answer, option C, fourth edition. Mesmerism is introduced in third edition. In fourth edition, Introduction to Organon of Medicine, the term allopathy and theory of chronic diseases. In fifth edition, Doctrine of drug dynamization, Doctrine of vital force and isopathy. In sixth edition, 50 millisimal scale and the word vital force changed to vital energy and principle. LM scale potency were termed as Q potency. By whom? Option A, Pierre Smith. Option B, Kunzli. Option C, Hering. Option D, Hahnemann. Answer, option B, Kunzli. 50 millisimal potency is explained in aphorism 270 in 6th edition of Organon of Medicine. This is termed by Pierre Smith, based on the principle enunciated by Dr. Samuel Hahnemann. Total number of succussion 100, denoted as 0/1, 0/2, etc. or 1/0, 2/0, etc. LM1, LM2, etc. The bacteriolytic enzyme present in saliva. Option A, taline. Option B, lysozyme. Option C, pepsin. Option D, trypsin. Answer, option B, lysozyme. Saliva. The volume 1 to 1.5 liter. pH 6.9. Specific gravity 1.0022 to 1.012. Digestive enzymes, salivary amylase and lingual lipase. Koebner's phenomenon is characteristic of option A, psoriasis, option B, Pityriasis rosea, option C, Pemphigus vulgaris, option D, Lupus vulgaris. Answer, option A, psoriasis. Koebner's phenomenon. It is an isomorphic lesion along the line of trauma, also seen in lichen planus, warts, vitiligo, molluscum contagiosum, lichen nitidus, discoid lupus erythematosus, which is the direct branch of celiac trunk. Option A, right gastric artery. Option B, left gastric artery. Option C, gastroduodenal artery. Option D, right gastroepiploic artery. Answer, option B, left gastric artery. Picture of celiac artery. What is the reason for golden color of amniotic fluid? Option A, RH incompatibility. Option B, fetal distress. Option C, post-maturity. Option D, IUD. Answer, option A, RH incompatibility. Amniotic fluid, pH 7.2. Volume, in 12 week 50 ml, 20 week 400 ml, 35 week 1 liter, 43 weeks 100 to 600 ml. Polyhydramnios, amniotic fluid more than 2000 ml. Oligohydramnios, amniotic fluid less than 500 ml. Functions, it protect fetus from trauma, maintain temperature, and promote surfactant synthesis. The type of shock occurs in the acute stage of burns. Option A, anaphylactic shock. Option B, septic shock. Option C, distributive shock. Option D, hypovolemic shock. Answer, option D, hypovolemic shock. Secondary action of medicine indicates. Option A, homeopathic aggravation. Option B, homeopathic cure. Option C, alternative action of medicine. Option D, none of this. Answer, option B, homeopathic cure. Oozing from rectum, smelling like herringbone. Option A, antimonium crudum. Option B, aloes. Option C, nitric acid. Option D, calcarea carb. Answer, option D, calcarea carb. Leucorrhea with strong odor of fish brain, sanicula. Fish brain discharge from ear, medicine, tellurium. Stool grassy, green, of white mucus, bloody, fermented, foamy, slimy, like frothy molasses. Options A, Macar. Option B, Cinna. Option C, Argentum nitricum. Option D, Epicac. Answer, option D, Epicac. Podophyllum, green, watery, fetid, profuse and gushing out. In Argentum nitricum, green, mucus-like, chopped spinach in flakes and turning green after remaining on diaper. Phosphoric acid, stool copious which does not exhaust. Malignant scarlatina and variola. Option A, variola. Option B, rustox. Option C, carbolic acidum. Option D, menianthus. Answer, option C, carbolic acidum. The Hidden Treasure of Last Edition of Organon, written by option A, Pierre Smith. Option B, J.H. Clark. Option C, Hahnemann. Option D, Hering. Answer, option A, Pierre Smith. When acute diseases assume a typhoid form. Option A, rustox. Option B, glonine. Option C, lycinum. Option D, belladonna. Answer, option A, rustox. Causes of hydramnios, except. Option A, anencephaly. Option B, spina bifida. Option C, diabetes mellitus. Option D, placental insufficiency. Answer, option D, placental insufficiency. Causes of polyhydramniosis, anencephaly, spina bifida, hydros fetalis, diabetes mellitus, multiple pregnancy. Then causes of oligohydramniosis, bilateral renal agenesis and fetal chromosomal anomaly. The rubric gluttony means. Option A, compulsive desire to eat. Option B, does not pay serious attention to anything. Option C, wants to acquire or having excess than required. Option D, paying little attention without understanding any consequences. Answer, option A, compulsive desire to eat. Frivolous means does not pay serious attention to anything. Greed, wants to acquire or having excess than required. Heedless, paying little attention without understanding any consequences. Boxer's muscle is option A. Trapezius, option B. Serratus anterior, option C. Psoas major, option D. Latissimus dorsi. Answer option B. Serratus anterior. Locking muscle, popliteus. Core muscle, trapezius. Tailor's muscle, sartorius. Anti-rib muscle, gracilis. Which structure does not pass through the carpal tunnel? Option A. Median nerve. Option B. Radial bursa. Option C. Ulnar nerve. Option D. Ulnar bursa. Answer option C. Ulnar nerve. Contents of carpal tunnel. Tendon of flexor digitorum superficialis, ulnar bursa, median nerve and radial bursa. Total number of medicines proved by Dr. Samuel Hahnemann. Option A 100, option B 99, option C 98, option D 72. Answer option B 99. What is Sheen symptoms? Option A local symptoms, option B mental symptoms, option C subjective symptoms, option D symptoms due to excess homeopathic medicines. Answer option D symptoms due to excess homeopathic medicines. Sheen symptom explained in aphorism number 248 in 6th edition of Organ of Medicine. Most abundant plasma protein is option A globulin, option B albumin, option C pepsin, option D fibrinogen. Answer option B albumin. Plasma proteins. Albumin normal value 3.2 to 5.5. Globulin 2.3 to 3.5. Fibrinogen 0.2 to 0.3. Carpal tunnel syndrome is due to the compression of option A ulnar nerve, option B median nerve, option C radial nerve, option D ulnar artery. Answer option B median nerve. Qualities of prover explained in option A aphorism number 72, option B aphorism 145, option C aphorism 126, option D aphorism 148. Answer option C aphorism 126. Qualities of physician in aphorism 83. Qualities of prover in aphorism 126. Single gene autosomal recessive disease is option A Wilson's disease, option B tuberous sclerosis, option C Huntington's disease, option D schizophrenia. Answer option A Wilson's disease. Autosomal dominant diseases are adult polycystic kidney diseases, Huntington's chorea, von Willebrand disease, neurofibromatosis. Then autosomal recessive disorders are sickle cell anemia, phenylketonuria, Wilson's disease, and hemochromatosis. Increased alpha fetoprotein is seen in option A hepatocellular carcinoma, option B benign mature teratoma, option C choriocarcinoma, option D teratoma. Answer option A hepatocellular carcinoma. Alpha fetoprotein elevated in hepatocellular carcinoma, multiple pregnancy, germ cell CA of ovary and testis, neural tube defects, and polycystic or absent kidney. Alpha fetoprotein decreased in fetal death and chromosomal trisomy. Who gave the name 50 millismol to the new method of dynamization? Option A Bonihassan, option B Kunzli, option C Dr. Samuel Hahnemann, option D Pierre Smith. Answer option D, Pierre schmidt. Skunk is obtained from option A, musk deer, option B, snake venom, option C, anal gland of wild cat, option D, throat skin. Answer option C, anal gland of wild cat. Santonin is the active principle of option A, cinna, option B, belladonna, option C, pulsatilla, option D, coffea. Answer option A, cinna. Cecal core, ergotin, simicifuga, macrotin, physostigma, esserin, Nagaricus, muscarin, epicat, emitin, syzygium, enlexin, aposanum, samarin. Medicine which is prepared from cat's milk. Option A, lac felinum, option B, lac caninum, option C, lac defloratum, option D, lac vaccinum. Answer option A, lac felinum. Lac caninum from dog's milk, lac felinum, cat's milk, lac defloratum from skim cow milk, lac vaccinum, cow's milk, lac vaccinum coagulatum from curd. Bufforana is prepared from option A, snail, option B, toad, option C, snake, option D, lizard. Answer option B, toad. Bufforana. Its drug strength is 1/1000. Convulsive seizures occur during sleep at night. Epilepsy at the time of menses. Sensation of heart swimming in water. Palliative in CA of Mame. When was the first round of pulse polio immunization started? Option A, December 1994. Option B, December 1995. Option C, December 1980. Option D, November 1996. Answer option B, December 1995. Health programs in India. National Anti-Malarial Program in 1953. National Filarial Control Program in 1955. National Leprosy Control Program in 1955. National TB Program in 1962. National AIDS Control Program 1987. Most common side effect of copper tea. Option A, pain. Option B, bleeding. Option C, ectopic pregnancy. Option D, perforation. Answer option B, bleeding. Other complications: pain, PID, perforation, pregnancy, ectopic pregnancy, CA, and expulsion. Torch infection include all except option A, rubella, option B, tetanus, option C, toxoplasmosis, option D, cytomegalovirus. Answer option B, tetanus. Torch, toxoplasmosis, rubella, cytomegalovirus, and herpes infections. Toothache ameliorated by holding cold water in mouth is marked in option A, coffea, option B, aconite, option C, belladonna, option D, all of the above. Answer option A, coffea. Toothache ameliorated by holding cold water in mouth. Medicines are bismuth, bryonia, pulsatilla, causticum, coffea, sepia, and natrum sulph. Natural method of family planning is option A, calendar method, option B, condoms, option C, IUCD, option D, OCP. Answer option A, calendar method. Calendar method is also known as rhythm method, introduced by Organon. Its complications are ectopic pregnancy, and embryonic abnormalities. Causative organism of AIDS is option A, paramyxovirus, option B, orthomyxovirus, option C, retrovirus, and option D, rhabdomvirus. Answer option C, retrovirus. It's an RNA virus. Most common type is HIV-1. National AIDS Control Program in 1987. Repertory of Hemorrhoids was written by option A, Gentry, option B, Gunsey, option C, Ner, option D, H.C. Allen. Answer option B, Gunsey. Repertory of mastitis and repertory of throat is written by Gunsey. What is the prognosis of third observation of Kent? Option A, good. Option B, very good. Option C, bad. Option D, none of the above. Answer option A, good. Good prognosis at observation number 2, 3, 4 and 11. Bad prognosis 1, 5, 6, 7, 8, 10 and 12. Universal immunization program was started in option A 1985, option B 1974, option C 1978, option D 1995. Answer option A 1985. An expanded program on immunization was established in 1974. 6 diseases included diphtheria, pertussis, tetanus, poliomyelitis, TB and measles. Red currant jelly stool is associated with option A, CA pancreas, option B, intussusception, option C, duodenal atresia, option D, acute pancreatitis. Answer option B, intussusception. Must change position frequently, but it is painful and gives little relief. Option A, causticum. Option B, arsenic. Option C, natron self. Option D, both A and C. Answer both A and C. Poison is everything and nothing is without poison. The dose make it a poison or a remedy, declared by option A, Dr. Samuel Hahnemann, option B, Stuart Close, option C, Paracelsus, option D, Rademacher and Hahnemann. Answer option C, Paracelsus. Pearson's formula is used for option A, race, option B, age, option C, stature, option D, cephalic index. Answer option C, stature. Child guidance clinic is helpful for option A, bedwetting problem, option B, impaired hearing, option C, eye squint, option D, cerebral palsy. Answer option A, bedwetting problem. Gold standard test for reflux esophagitis. Option A, endoscopy. Option B, barium solo. Option C, 24 hours pH study. Option D, X-ray of abdomen. Answer option C, 24 hours pH study. During proving of the narcotics, we observe the option A, primary action. Option B, secondary action. Option C, alternating action. Option D, all of these. Answer option B, secondary action. In Kawasaki disease, the cause of death is option A, coronary arteritis. Option B, cerebral infarction. Option C, pneumonia. Option D, renal failure. Answer option A, coronary arteritis. Bedsore is an example of option A, post-thrombotic ulcer, option B, tropical ulcer, option C, trophic ulcer, option D, venous ulcer. Answer option C, trophic ulcer. Frothy copious blood-tinged sputum is characteristically seen in option A, acute bronchitis, option B, mitral stenosis, option C, tuberculosis, option D, acute pulmonary edema. Answer option D, acute pulmonary edema. Then craving for potato is a symptom of option A, psoriatic, option B, psychotic, option C, tubercular, option D, syphilitic. Answer option A, psoriatic. Which of the part of body can be used as a route of administration of medicine? Option A, blood vessels, option B, skin, option C, wounded skin, and option D, nerves. Answer option B, skin. First repertory in English language was published by option A, J.T. Kent, option B, Dr. Lippi, option C, Dr. Constantine Hering, and option D, Dr. Pierre Smith. Answer option C, Dr. Constantine Hering. Creosotum is inimical to option A, carbovage, option B, calicarb, option C, nux vomica, and option D, phosphorus. Answer option A, carbovage. Devil's dung is the common name of option A, Baptisia, option B, Asafoetida, option C, Melanotus, and option D, Helleborus. Answer option B, Asafoetida. Seat belt causes injury to option A, duodenum, option B, thorax, option C, neck, option D, all of the above. Answer option A, duodenum. Lochia rubra is seen up to option A, 5 days, option B, 10 days, option C, 15 days, option D, 20 days. Answer option A, 5 days. Homeopathic aggravation is the option A, primary action, option B, secondary counter action, option C, secondary curative action, option D, alternative action. Answer option A, primary action. Author of sensation as if option A, Dr. Hahnemann, option B, H.A. Robert, option C, W.A. Allen, option D, Bonnie Hassan. Answer option B, H.A. Robert. In BBCR, where will you find rubric confusion? Option A, mind, option B, sensorium, option C, aggravation and amelioration, and option D, head internal. Answer option B, sensorium. Please subscribe our channel. Press bell icon to get continuous updates. Thank you.